Okay, let's talk about setting up a board to vet sound healers going into hospitals. This is no small project, but let me give you an idea of what we're thinking about. We're not talking about setting up a national board yet, although this would be the precursor to it. And the only reason we're not setting up the national board is because it's a little too much work. I mean, it's no small deal to get a national board, and the whole point is to be able to have insurance pay for treatments, right? That's the whole goal, right? And to have some regulations, right? But that's really not a easy process. It could take years and really dedicated time, and we I would like to do that eventually, but I'm not ready to take that on quite yet. So this is kind of the beginning, and it's really just a interim board to provide learning for people going into hospitals, especially on safety guidelines, right? Because if you're not careful, you can hurt people, especially when they're really fragile in hospitals. In fact, it's really tricky because, you know, I mean, when can you actually do sound if someone's just right out of heart surgery? I mean, I don't even know myself, right? I mean, I would wait at least a couple of weeks, and a lot of it, I mean, if I were doing it, I would just use my own intuition and just see, if they're ready, and then start softly, and but this should all be written out, and it's not just for heart surgery; it's for any type of surgery. If we're doing sound on pain, someone's got a broken bone, when do we start that, right? If someone's got cancer, is there any problem it could actually cause, or what are the different problems you have to watch out for? And we've been looking at these safety issues in the meetings for the last couple of years, so we got a lot of guidelines. We got some ideas. I mean, if someone's got PTSD, you got to be really careful about re-triggering that trauma, right? And this is just really critical for people to know. But also, people should have to study the information we've come up with. I mean, I wouldn't go, if I were going to do a treatment on anybody, I would really want to know what people have come up with already for any of these issues. So you got, something you could add to it. Maybe you've got a really cool protocol that's very general that just gets people into love and light. That's beautiful. But you know, if you can add a detail for someone that's got PTSD or addiction, right? Then that's very cool. So we're not prescribing any treatments. There was a couple of people at the school, Lisa Raffel and Joshua Leeds, that tried to put together a board about uh, about 10 years ago, and they had a lot of meetings and ended up failing because there was a lot of people that wanted to do their treatment plans and prescribe them, right? And they got into arguments and they started having fights, and then people started threatening, and it was like, oh my God, right? We're not prescribing anything. You can do whatever you want, but you need to know these safety guidelines, right? And the whole goal of doing this is to be able to make hospitals feel more comfortable bringing in sound healers into the integrative therapy department. We are not talking about the medical side here. We are not talking about bringing sound into the medical side. That's FDA approval when you do that, right? So we're talking the integrative therapy side, right? Now, the first interesting thing And I don't even know. I'd like to do a little research, and maybe if anybody knows here, is it's not real clear how many hospitals have integrative therapy departments. Oh, we can always just do a search around here. Let's do a search. How many hospitals in the U.S. have integrative therapy departments? Wow, many are funded by philanthropists. Yale, Duke, Johns Hopkins. Well, they must have an integrative therapy department conferences, right? I know Kaiser's got a small section. I mean, I've got there's a it's actually universities often have it when they're university hospitals. Because I had Massachusetts General paid $10,000 for me to do a whole series of CDs for their integrative therapy department. Yeah, well, partnering with music therapists, Nina is talking about music therapists. This is tricky and it's kind of a problem. See, music therapists are really, or at least the Music Therapy Association, some music therapists as well, but especially the Music Therapy Association, are really strict about their protocol and their training, which is extensive, to be able to bring it into hospitals. So we're up against that, and that is a tricky aspect, right? Because a lot of people are going to say, well, how much training? I mean, they should have like so much training and have to do 3,000 hours of practice before they go in the hospitals. So we're going to be up against that. But uh, so, but yeah, the music therapists are not going to be talking to sound therapists. I can tell you that right now. I know that because they will say, "Oh, you just need to get music therapy training and go through and get a whole degree in it," right? Which is understandable.
Yeah, so David, this is Nina. I'm just, I started thinking about this as you mentioned hospitals, because I know there are a number of, and you just showed number of hospitals well known throughout the nation that have integrative programs that include music therapy as a component.
And sound therapy. There's sound therapists throughout hospital integrated therapy departments around the country. I know. So it's not like they're not letting them in.
Right. Okay.
Hmm.
Well, I think, working together rather than at odds is our best bet over the long term, right?
Yeah,
You
yeah,
know, yeah.
yeah. They're not going to work together. In fact, in Nevada, they have tried to outlaw sound, saying you have to be a trained music therapist to use any music on clients. I know
Yeah.
there's.
So, I mean, that gets to their accreditation standards, I mean, we want to be maybe talking at the legislative level in concert with, right? I mean, of course, they're going to want to protect their territory, but helping them recognize that an expansion of the capabilities in this area benefits everyone. It would be a long term process to try to collaborate with them, but I think we can't not make that part of the effort. You know?
Yeah, I think the path. I mean, I think the only time we're going to be able to collaborate with them is once we get a national board uh, because otherwise they're going to say we don't have credibility, which in a
Mm.
certain sense we don't, right? And so it is going to be really tricky, and we're going to be. I mean, even the hospitals we're probably going to come up against this. The hospitals are going to go, "Who the hell are you?" right? Because the whole thing is to actually go to hospitals and say, we've got this whole protocol for bringing in. I think there's a lot of hospitals that are going to totally go for it because they're already doing sound, and they can go, oh, well, we can just have a little more safety here, and that works. That totally makes sense will make sense to them. But there's some people I'm sure are going to say hospitals that don't have sound where they're going to go, well, before we can bring in these sound healers, you need to have a whole board, right? Because although there doesn't seem to be any law about it, because there's all types of people doing I mean, there's any and everything in integrative therapy departments. I mean, there's Reiki in integrative therapy departments, big time,
So,
right?
David, which hospitals do that you're aware of do currently have sound therapists on staff?
I know we did a search around the San Francisco Bay Area, and there was just about all of them had some sound that they were doing. And I know a ton of students that are working at different hospitals from Florida, in this all over the country, right? So I don't have it all mapped out, but there are sound healers throughout the country in integrative therapy departments. So that's one thing. Probably the okay. Here's one thing we could do is we need to do a survey of how many of what of first of all a list. We need to get a list of list all integrative therapy departments, right? Because there's a lot of hospitals that don't have it. In fact, I just had one nurse in the sound healing program. She said, "I don't. I'm a nurse, and haven't seen any integrative therapy departments in hospitals." Right? So there's not like that's everywhere. And then we list all sound healing in integrative therapy departments and research, because there's NIH, and there's a whole group, a research group at UC Med Center here in San Francisco, where they're doing a whole range of research on sound and music. So this we can use as credibility to move forward, right? We could say, look at all these other hospitals doing this. What's your problem, right? That will help right there. Um, the main thing we're looking at is having an exam. So they have to study the safety guidelines, and then they have to study the different treatment plans, and then we have, like, 50 question exam. And I think a lot of and if we then go to hospitals, they're going to go, oh, this totally is cool. If we have anybody come, we'll send them over to you and have them take these exams. Right? I'm not thinking to have any specific classes they have to are required to take, although it might end up being that way. I'm thinking just have them read over the medical sound the treatment plans of for every issue would be enough right there, is what I'm thinking. There was Lisa Rafael was talking about having a feedback system so that we track uh, what they do. Have a tracking system, that would be really cool. At least have them have to fill out a form of symptoms before and after, and what they did for every session. I mean, we've got already on the Medical Sound Association site, we've got the intake forms, and we're starting to get a lot of people that have filled this out where you put in the symptoms before and after a treatment. Look what we've got now. We've got over 350 entries, 375, 68.53 reduction in symptoms. Right? So, and then you can actually search for anxiety and filter that. And we got 221 entries, 71% reduction in symptoms for 220 people. Or anxiety with frosted crystal bowls, right? 165 entries, 69% reduction in symptoms, right? So they would fill out the form and it would go into this database, right? But it would be nice to have it per person that they can search for them as well. We could search for, you know, David Gibson, see what all there's, see what how effective, so we can do tracking that way. Any comments or thoughts on this? Anybody really interested in working on this?
David, this is Nina again. I'm very new to this, but I'm also keenly interested and would be happy to volunteer some time if somebody can direct me uh, in terms of priorities and things to take a look at.
Yeah, we're gonna get a code of ethics that uh, that yeah we've got all the research projects on our Sound Healing Research Foundation that the NIH has done. We have all the clinical papers, uh, so you can search them on our site right now. Um,
Great.
so under Sound Healing Research Foundation. What I'm thinking is the main thing is to get a the website and the protocol laid out. We'll get that set up, and then the main footwork is going to be going to hospitals and say, look, what this is what we've got, to vet. Uh, if you would like to partner, we can, you can use us to vet anybody coming in, which will basically ultimately be a avenue to help people get in. So we can say, look, we've got all these integrative therapy departments, and here's a list of all of them. If you're interested in going into a hospital and working, you could volunteer, some or some pay, and then so it becomes a whole way of funneling people into these integrative therapy departments, which is really the whole goal, is to get, help people.
Yeah, I would be interested in also to help out.
Okay.
I really want to look into this, especially, like here in Florida and the Miami area, because which I noticed, I don't know, maybe some other parts of Florida, it's more common, but around Miami and here in Miami, which I'm noticing, it's a pretty new thing, but people really interested in it. So
Yeah.
I'm researching lots of things. So I'm
I
definitely would love to be help. You know.
I have a student from 10 years ago that was already in a hospital going from bed to bed with crystal bowls, right, in Tampa. And she said that in Florida, to be able to work in hospitals, you have to have some type of certificate, which the certificate from our program is totally enough.
Well, that's amazing. That's amazing. Yeah. So yeah, I definitely will look into this. And yeah, I appreciate also some guiding. Like if you can direct or anybody can direct. What are the next steps?
So from there, you know, I mean, if we're going to go ultimately into a national board, basically, here's another component that we're I was thinking about this morning, and that is guidelines, not only safety guidelines, but safety guidelines for specific, not only issues, but specific instruments. Like, you know, no gongs in the anxiety ward. If someone's having panic attack, no gongs, right? Things like that. Like how a list of instruments that can be dangerous. I mean, crystal bowls are way too much for someone having a panic attack. We got to be careful because we could like get the hospitals thinking, oh, we shouldn't be doing any of this, right? But I don't think that's going to be a problem. I think it's when they realize that there. I think we should be able to say, you know, pin it down and say, and we can work with the doctors and the hospitals as we go. So we can say, okay, well, we've said no, no sound on the body within 3 weeks of surgery. Right? Soft sounds, soft sounds around the body, soft sounds or music for uh, actually, you know, when I was out of surgery, the music, I had my computer there, and I played music. It was the best. I mean, immediately after surgery. I mean, it was so nice because I was felt like I was in on psychedelics, right? Especially with the drugs. It's like, God, give me a little morphine and let's listen to, you know, unconditional love. This is great, right? So that it's so that's cool. Soft sounds or music only.
Well, I think there's definitely more data needed, but it was a really crazy story. I had an appointment with a client, and she was an older woman, and so I always make sure older people realize they need headphones for doing remote stuff. And I forgot to mention that to her, so I called like 20 minutes prior to the appointment, and needless did I know, she was in the emergency room having some kind of trauma. And I didn't really know what to do, and Spirit just said, give her some sound. And she couldn't respond, but somehow she answered the phone. And finally, the nurse came over like after 15 minutes or so, and picked up the phone, and I was talked to the nurse. I asked her, does she want me to continue with the sound? And she didn't try to say anything until I asked that question, and her answer was a resounding yes. so, so just you know, I think there are definitely traumatic situations where there's active trauma, the right instrument, but definitely not a gong.
Yeah, yeah, yeah. Nice. Any other thoughts on this?
David, I've worked in the medical field for over 20 some years, and I know they're so strict about guidelines and competencies and licensure. It's just insane. What I'm not saying that sound can't be in integrative departments or integrative parts of the hospital, but I know the way hospitals run, and they're very strict about everything. Everything is up by the line, and everything is really they really want their information.
It's really bizarre. It's like, I know that's true, but then they've got like integrative therapy departments doing, you know, quantum healing. Right? Well, how can they vet anything about that? Right? So there's this real dichotomy between the integrative therapy departments and the medical side. It's almost like a completely different group. Right? Now, it's interesting because, of course, then hospitals that like Kaiser that have insurance, they're wanting to do things like this because they want to bring down costs, right? Whereas hospitals that don't have insurance companies don't care as much. I mean, the other thing to think about is when we're doing this to use it as an avenue to, as an end to actually start doing research.
Yeah, and I think that's where the academic medical center um, hospitals could be um, a better play because they're at the nexus of research and providing
Mm-hmm.
care.
Cool.
The other thing I was thinking about is a payer strategy. The insurance companies. How did acupuncture become something that would be reimbursed by insurance companies? How did some of these other integrative therapies become something that is reimbursed by some, not all, but some insurance companies? And we might want to look at those models. What did they do, and see if there's something we could learn from them? Because
We,
right,
we,
hospitals care about if something gets paid for.
we did detailed research on and actually found the guy that was the head of getting acupuncture approved in for as a board.
Mm.
So we've gone through this about 5 years ago. We went through it in detail, and
Mm-hmm.
that's when I realized this is no small process because it's really, you get government involved. It's really a big deal to do
Yeah.
it and
Yeah.
to get approval. So but that's the trick. We actually can talk to these people that have done it for music therapy. We've done it for actual these different areas and get some help and really follow their guidelines. But I just doing that research, I learned it's not easy. And one day, but I've just got too many other projects right now, and maybe someone will come along that's ready to go on this. Yeah, it's going to be interesting to see. I have a feeling that the integrated therapy departments, since they're so woo woo, right, they're going to be really open to this because they're going to, why not? Why not, make it safer for people to come in? And then, yeah, it could be really cool. It could open up a whole doorway. The other thing that I thought about doing is then going, ultimately having the board of our group of this, I'm thinking to call it Medical Sound Association Board, go to hospitals that don't have integrative therapy departments and say, look, we have all these different protocols for all these different issues. Take a look and see, if you could get funding and set up a little, ward, a whole, wing of this. And not only that, but we could take all these different treatment plans. I already got soundforhospitals.com, and we can actually have all the different treatment plans and say, look, all these different protocols you could actually incorporate in your current integrative therapy department, right? Oh, we don't have the people. Well, we can help you find the people to do it. Okay. It's interesting. I had um, a kid come in with severe autism last week and is 7 years old. And we ended up playing a whole range of music for him to see what worked. And then also put him on the sound table and played each of the 12 notes. And when we got to his note, he got really still because he was all over the place, right? And then someone else sent me a video of one of my songs being played for a kid with autism. Let me show it to you. Oh, and here we go. Hmm, Here we go. Here it is. Check this out. It's interesting because, I was always thinking with severe autism, you have to be careful with too much activation. And I'm finding that it's not necessary. It can be, but it's not necessarily true. Because that's a pretty activating song right there. That was antidepressant. Okay. All right. Well, that's really all I have for now. I'm thinking to going to get the code of ethics that Lisa Raffel's group came up with after a year of trying to do this, and then put a website together, and then I'll send it out and see what everybody thinks, and maybe have another little meeting on it. Any thoughts or comments?
Just the thing is, what's the next step?
Yep, yep. I'm gonna get the code of ethics. We'll create the website and then get feedback on what we have. I think it's the next step. Cool. Okay. Well, that's have for today. I'll have the treatment plan for heart conditions posted within a week here up on the Medical Sound Association site. And I'll send out the video to everybody as well. Any final thoughts or comments before we end? Okay, let's do this. Let's send a sound of love to everybody that has a heart condition and everybody that is not got enough love in their life. That would be just about everybody. Right. Okay, unmute. Let's send a sound of love to all of us. Thank you all.
Thank you.
Thank you. Thank you.
Well done.
Till next time.